Hi, Dr. Buttler here. Thank you so much for taking the time to learn more about your health today. Wanted to speak to you on a topic of leaky gut. Leaky gut is a term that is newer to healthcare, hasn't been around for a long time, but more and more people are becoming aware of the concept of inflammation and the impact of our gastrointestinal system in regards to an inflammatory process. And leaky gut is, by all means, a very relevant concept that ties into the health of you, the health of us as individuals, and specifically to within our functional capacity to manage adversity, manage toxicity, manage many types of ailments that we deal with. So the term leaky gut, as you can imagine, just by definition, means that the gut's leaky. Now, that does not mean that it is like a sieve per se, where it's just fully open and things are just moving entirely into the body. If that was the case, we would be dealing with life-threatening infections that would be happening all the time. Now, some people do get life-threatening infections that can occur from the gastrointestinal system having something like an ulceration or having what's called a fistula, something to that degree that is causing bacteria to go out into the system or the gastric contents. That's typically not what's happening when we describe this term leaky gut, and the impact, as I said, that plays into all of us. It plays into all of our health concerns. So what happens really is you have the lining to your gastrointestinal system, to your mouth, your esophagus, your stomach, your small intestine, and your large intestine. And within that lining, there are what are called villi, and they're these like finger-like projections. So like on my fingers, this kind of comes up and then it goes down, and then this goes up and this goes down, this goes up and this goes down. And that at a microscopic level is what the gastrointestinal system looks like. If you want to know what the inside of your stomach looks like or the inside of your intestines, just look at the inside of your mouth. It's all the same tissue. I kind of have a funny concept I like to tell my patients, from your lips to your anus is one long tube. It's one long continuous tube. It all roughly looks about the same. If you ever see like colonoscopy pictures, looks like the inside of your mouth. So that tissue looks the same all the way through. But again, if you magnify it down, you get a picture of these villi that are, like I said, going up and down. And what that does is creates a surface area, a larger surface area that allows the body to have more capacity to digest, to metabolize, and to eliminate. And we want that surface area to be large. We want it to be very robust. We want it to be very strong. That allows us to have a reaction potential within the tissue state that keeps things out that need to stay out, keeps things in that need to stay in. With regards to the GI tract, there's these very selective areas that allow certain things to make their way through. If you think of it as like a gate, but it's very guarded. It's very guarded. The body only wants to let through what it wants to let through, wants to keep out, like I said, things that maybe cause more inflammation, things that can cause infection, things that can cause disruption to the body's physiology. So it works very well per its design. When the gut is vibrant, when it's healthy, when it's functioning well, it is a huge asset for the health of your body's physiologic state. When that tissue starts to break down, when that tissue starts to become inflamed, when that tissue starts to lose that robustness that it has, it becomes susceptible to what we'll say is, a pro-inflammatory state. What's coming to mind right now is my garden. If I water my garden well, it gets good sun, it's nice and robust, I don't get a lot of pests. If I don't take care of my garden, and I'm not watering it, and I'm not putting good compost into it, and I'm not culling off the leaves that need to be culled off with, it starts to get more pests, aphids and slugs, and things start to come more onto the plants, eat the vegetables, and then I don't have any vegetables to eat in the summer. So that's the way your gut is when things are being stimulated into the body's physiology, when blood flow is there, when lymphatic flow is there, when enzymes are functioning, that robust vitality is happening within the gastrointestinal system. So as things start to wear down, and how does the gut start wearing down? Well, in my experience, there's only a handful really of primary things that'll wear down the gastrointestinal tissue, which can set us up for a concept of leaky gut. The first and the biggest one initially that we think of is our nutrition, what we put into our bodies. Every time you put something into your body, it carries with it a level of burden. That burden can be very small or it can be very large. So let's say, for instance, again, you have burger fries and a milkshake. That food choice has with it greater burden. There is more content within those substances that instigate an immune reaction that happens at the level of your digestive system. It's kind of like a battle going on in there in your GI tract, where your immune system's having to respond to added sugars, preservatives, toxicity agents, pro-inflammatory agents that are found within our food choices that instigates this immunological response. And that immunological reaction that's taking place, if that happens one time, it's not a big issue. Happens, moves through, body regains balance. And a lot of times, initially, if you can remember back to your health, I see this a lot in my patients. When they come in, they're very progressed into their health concerns, but if I get their history, they're like, at one point I used to get diarrhea, or I used to get some type of gastrointestinal reaction that was an eliminatory or an elimination reaction that moved the content out. That's the one way the body deals with it. Just comes in, we don't want you in here, we'll move you out, okay? And for different people, some people will react in different ways, but that's a common one that might make sense to you of how you react. So nutrition, significant. What we put in our system day in and day out is going to have an impact on the inflammatory reaction state that starts to occur within your gastrointestinal system. And usually we don't get a lot of feedback in the mouth. We can with like mouth sores and things like that, but we start getting things like heartburn. That's a leaky gut phenomenon. Leaky gut, remember, is not by itself the condition. It's the result of the inflammatory process that goes on over time in the individual that causes that permeability to start opening up. But heartburn, infection of H. pylori, which plays into usually heartburn or ulcers or things of that sort. In the small intestine, SIBO, small intestinal bacterial overgrowth, starts to play into concerns that get to a place of leaky gut. And leaky gut then can build on, SIBO will build on itself if the gut permeability continues to be in an inflamed state. But SIBO is something, if you're familiar with that concept, that can play into a leaky gut phenomenon. The health of the pancreas and its exocrine activity, it pushes out enzymes into the digestive system that are needed. The large intestine is also relevant and a factor based predominantly on your probiotic bacteria within that region of the body and how well you're hydrating and rehydrating and eliminating. Constipation is going to create this backup of toxicity into the system that starts to create an inflammatory state. So, like I said, lips to anus, the whole tube, all the way through, generally speaking, is going to have areas where adversity can start showing up, inflammation can start showing up. Nutrition, significant player that starts to create an environment where that can take place. So what's the next one? Medications. Another significant piece of what can play into the toxicity of the digestive system and the impact of inflammation on the body. And medications range from many things that we just do over the counter to prescription medications. I mean, the biggest prescription medication culprit are antibiotics, and we're becoming, which is wonderful, more and more aware of the impact that antibiotics have taken on us as a culture, and the impact that that plays both into developing a concept of antibiotic resistance. And there's a theory that in about 5 years, 5 to 10 years, we're going to run out of antibiotics. We're not going to have antibiotics anymore in our therapeutic ability to treat infection because of the overuse of them and the adaptation that the body has taken to resistance within the bacteria that does not get killed off by the antibiotic. Is there resistance that gets created and they stop working. So, but what antibiotics do is antibiotics kill bacteria. They kill the bad bacteria, which at certain points, of course, is indicated. But when they're used in repetition, I was just at a wonderful gastrointestinal conference over the weekend, and there's a statistic that on average, by the time an individual is of 16 years of age, they'll have taken 17 rounds of antibiotics. And predominantly in our childhood illnesses and ear infections and tonsillitis and sinus infections, we are, and bronchitis, another good one, we are oftentimes just given regular, repeated dosing of antibiotics, which has this major impact on the ecology of our body's gastrointestinal system, which starts to influence the health of that tissue. Remember that vitality of those, what are called the villi and the crypts that are packed with probiotic bacteria. It's this ecosystem that works in synergy in an effort to maintain a nice kind of boundary, a border that keeps brings stuff in that we need and keeps stuff out that we don't need. So you really want to work at avoiding the regular use of antibiotics. If you have to redo an antibiotic for the next infection the next year, you've got to start looking at why is this happening and what can you do to change the pattern, what can you do to change the reaction state that's occurring. So antibiotics are a big one. Ibuprofen, Advil, Tylenol, other significant, those non-steroidal anti-inflammatories, significant contributors to the health of the gastrointestinal system. They create a state of gastritis, wears down that lining of that gastrointestinal system. So we want to work to avoid those. So medications are a big area that comes into play. The other big one that I love talking about is stress. So stress, very relevant as it plays into the concepts of leaky gut. We have what's called an autonomic nervous system in our body. That autonomic nervous system has a side of it called fight or flight, has another side of it called rest and digest. When we stress, we move blood flow away from the digestive tract. It goes into the large muscle groups because the body's anticipating that we're going to have to fight, we're going to have to react, we're going to have to respond in a very physical manner. The blood flow goes away from our gut. If you don't have good blood flow to the gut, you're not going to water the plants well. That tissue is not going to stay nice and vibrant and healthy and vital. It's going to start wearing and getting weak and creating these these non-robust villi that are strong and holding and doing a very good job of maintaining that boundary. So stress is a big player in regards to our health. We have to understand that we're going to be okay, that you're going to be okay. There are things that we have to take care of in our life. There are problems that we have, but our reaction state, our reaction of when we respond, of when we push into that fight or flight state has a very significant impact on the health of our gastrointestinal system, which will contribute to a state of leaky gut. So nutrition, medications, stress, toxicity is another big one too, just our environmental toxicity, which, there's toxicity around us, and you do your best to avoid it, and you make choices and buy appropriate cleaning products and body products and work to reduce, because that toxicity gets into your system, that influences the health of that tissue. So the thing to remember is that leaky gut is not by itself the issue. It is a reaction state that has occurred due to the burden that comes into your body's state of physiology. You can change that burden. You can change your nutrition. You can reduce your need for pharmaceutical prescriptions and over-the-counter therapeutics. You can change your belief system. You can improve your stress response. You can lower your toxicity. If you do that, your gut will start healing. It's just like the garden. If you put the right things in, right formula, give it time, be persistent, it'll start to heal. You can heal. Thank you again for taking the time to learn more about your health today. And until next time.